Welcome to the Nourish Together Gut, Heart, and Mind podcast. I am so grateful to have Lorraine Maita here with us today. Lorraine is known as the Hormone Harmonizer, and she is board certified in regenerative medicine. And I am just super excited about this conversation. We'll be talking about hormones, gut health, and detoxification for longevity and for overall well-being. Thank you, Lorraine.
Oh, thank you for having me. I love getting the word out because I want people to live younger and healthier. I want a healthier lifespan, not necessarily longer. Can't guarantee length, but at least the length of time we're on this planet, we should enjoy it and be healthy.
I so agree with you. And that's exactly why I do what I do too. And I would love to just hear from you what it means to be a holistic longevity doctor and in this space with, especially as it relates to women and hormones.
Well, I got into functional medicine and, I'm getting into longevity because I'm getting older, but I developed tuberculosis when I was working in the emergency room in New York City, and I was on antibiotics for 9 months that cured the tuberculosis, but then I was left with feeling, well, tired. I had rashes, I had yeast infections, I was gaining weight, I was losing my hair, I had brain fog. I felt awful. I said, if this is the cure, then I didn't feel alive or human anymore. And that's how I got into gut health. And when I started learning about that, it's like, wow, within 3 months, I was back to normal, really. And then I started working for a big company, and I worked in the emergency room. I could save your life. I could bring you back to life from a heart attack. I mean, I really you did ICU work. I did all of that stuff, but I wasn't prepared when a senior female executive came down to me. And that was back in the day when there were very few women in executive positions. There were probably about five in a company of 120,000 people, right? And
Wow.
at high level positions, right? So she came down to me and she says, "You have to help me." She said, "I'm giving a lecture." And all of a sudden, I broke out in a sweat. I felt my face burning. I lost my words. And I just was so humiliated because men were either casting their eyes down in shame, like, I can't look at this, or they're elbowing each other, like chuckling and snickering, like, look at this. So she said, you really have to help me. I wanted to help because I said, you know what, we've got to keep women have to be able to rise to greater levels in companies, and we have a lot to offer, and I wanted to help her. So I had been interested in hormones when I was doing my residency,
Mhm.
so that sort of re-sparked the interest. And then when I went through perimenopause, and oh my God, tired, moody, anxious, irritable, can't sleep, gaining weight, right? My
Mhm.
best friend said to me, your personality changed. And I realized, oh, you know what? This was around 9/11, and I used to live in New York. So
Mm.
I um I said, you know what? I bet you I'm in perimenopause. And I took progesterone, and it was like, same stress was there, but
Right.
I could deal with it. But I had so many people coming to me like, I'm getting older, I'm tired. And I see, what's the difference between people who are older and healthier versus not? One of the things is hormones. Another thing is diet. And most of all, it's attitude too.
Right.
It's how
But
you take care.
sometimes, like you said, you need the little help to get the attitude adjustment. There may be something biological too, right?
Right. So I just, watched people age, and unfortunately my father died before he saw me graduate from medical school, and that
Mm.
that really bothered me. And I always said, I want to help people preserve their health as long as possible.
Yeah. Oh, I totally hear you. So what is this, what would the holistic portion of it be as far as, you said you were in the emergency room and you could do all that, and then this woman came to you and you knew that hormones played a big role and you wanted to help her figure that out. Where's the holistic part come in?
Well, it's a lot has to do with the gut. I mean, when I had that I felt terrible after being on antibiotics for so long. I
Mhm.
realized there's more to it than just killing the bug. It killed
Yeah.
off a lot of good bugs in my gut. And what I learned is aging is a process. It's oxidation, inflammation, glycation, hormone decline, and your immune system declines. So inflammation, we call it in functional medicine, inflammaging. It's the root cause of most illness, and inflammation is the root cause of allergies, asthma, arthritis, autoimmune,
Mhm.
cancer, diabetes, heart disease, stroke, all of that. So
All of it.
we can decrease inflammation. That's the root cause, right?
Hmm.
And inflammation has a lot to do with your toxin exposure, the food that you eat, what you're breathing. We were talking about wildfires, air pollution can is a toxin. You can take toxins in breathing it in, eating it, putting things on your skin, and
Right.
being in a toxic environment and being around toxic people. So
Yeah.
the holistic part is to, I tell people hormones control you, but you control your hormones. What you eat, what you drink, how much you sleep, how much you exercise, the stress you're under, the toxins you're exposed to are all going to affect your hormones. So the holistic part is eat, drink, be
Right.
clean, use clean products, right? Uh,
Hmm.
get enough sleep because we all drive ourselves and hard, and we're on our tablets and our phones and our computers to the wee hours, late at night, and that blue light disturbs the production of melatonin, which is the hormone that helps you sleep. And people late night snacking, light and food
Yeah.
disrupt your sleep, and that disrupts your circadian rhythm, which we all live in rhythm. And that clock that comes from up here in the pineal gland is the master clock. And if the clocks are not in sync, the clock
Hmm.
to detoxify in your liver and the top clock to make certain hormones at night, if it gets disrupted, your body doesn't know what to do when, and
Hmm.
you're out of sync, and that's how you can age. So
Right.
yeah, sleep is important, and I've spent probably 25 years in big companies, and I also specialized in occupational and environmental medicine, and I learned that even though that field was like big exposures, like an explosion or you spilled something on you, whatever, nobody really talked too much about the little drip, 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 drip.
Right.
Little exposures over time, and people don't realize, I do tests for toxins, and they say, but I eat clean, I drink clean, I'm everything, I'm perfect. Well, any toxin you've been exposed to, even since birth, gets
Hmm.
stored in your fat and your bone marrow.
Yeah.
And as your body does not want to lose weight because it doesn't want to release those toxins. And the thing is, you start, in perimenopause, you start to lose bone. So the toxins and the metals especially start coming out of bone, and you get, it disrupts your immune system, your nervous system, your hormone system. So, I tell people, eat eat the best you can organic, at least the Dirty Dozen that's
Hmm.
published on the Environmental Working Group. And the Clean 15, you don't have to eat organic. And, I look at when I go shopping, if there, I try to buy organic, but like I'm not going to spend $10 for a few strawberries. So I'll eat them
Right.
in season when they're organic, or if there's just a slight price difference, I'm going to buy the organic. But I understand not everybody can buy everything organic, but you can not heat in plastic. You can, that's pretty easy to do. And you
Hmm.
can, as you run out of products, buy clean products.
Yeah.
EWG.org has an app called Skin Deep, and you can scan the barcode and you can buy clean personal care products, clean uh, cleaning products, so that it's every little bit counts and you don't have to be perfect. I mean, people get overwhelmed. So as you start running out, then look for something cleaner. There's a lot of clean products out there that are not so expensive.
It's true. And even, I mean, in the major big stores, you find a lot of the clean products, or people can get subscriptions online if you just search for, clean products, look at the EWG list. And I love that because I love what you said about the drip, 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 drip. What we don't realize is that today we have so many sources of exposure that we're exposed to on a regular basis. So whether it's like the microplastics in bottled water and microplastics from a number of other issues, sometimes even humidifiers that are made from plastic and are, in the house. Like if you start looking at it, it can be a little bit crazy making because there's so much, but pick one area at a time. I love that you said that. 'Cause it's like clean products, run out, start with a new one. Um, in the UK a few years ago, they did a study that showed that the average woman was putting about 500 chemicals in her
Yes.
body, right, in the morning before like walking out the door, between the shampoo and the conditioner and the makeup and the nail polish and all the different things. Of course, many of us might not do all of those things, but again, it's this notion of just be really informed about what's in it. Try to find the sort of formulas that are the easier on the person, on the environment. And when you mentioned working for bigger companies and doing a lot of the environmental stuff, like what was that like, and what was some of the main things that you saw as far as harm to people, or and was there anything that was different to women specifically going through perimenopause and menopause?
So really what I found that worked the best is to stop the influx. I mean, detoxing is decreasing the amount going in and increasing the amount going out. I was very fortunate to work for companies that listened. They listened. I said, I think there's a problem here. Let's fix it. And they fixed it. So we never really got to a point where there was big harm. They were very, very concerned with safety. I worked very closely with safety, and we had a whole department dedicated to making sure the job was safe for you and you were safe to do the job.
Mhm,
So I did find that in the day when chronic fatigue was a thing, it's still a
mhm,
thing, but
right.
when anything is new, it's discounted. It's
Mhm,
And what I realized is everyone was poo-pooing it, but I had some people with chronic fatigue, and I believed them, and they needed special help. And I'm a little bit of a nerd. I research, and I did see that they had differences in their natural killer cells and other things that people were just ignoring and thinking it was a fake. So I mean, I was fortunate to have been able to be an advocate for these people, to give them more rest and have flexible work arrangements, and so they could keep their job, and so that they could be healthy again.
mm,
So, with women more often had chronic fatigue. And what I found is that women going through perimenopause were suffering a lot, and
mhm,
nobody was paying attention to it. Absolutely nobody was paying attention to it. And that's when I went through my own, it was like, oh my gosh, oh my God. I didn't, sometimes you can't be objective about yourself, but when your best friend tells you
right.
your personality's changed, it was the wake up call for me. And I said, wow, and at that time, then Suzanne Summers was the first person to talk about it. But there was a book, um, God, I forgot what his name was. He wrote a book about perimenopause, and it rang home. It was a very old book, but it rang home. And I said, my God, there's a lot you can do about this. You
Mhm,
can just bring your estrogen in balance by having more fiber, right? And there's nothing sexy about fiber, but let me tell you,
yes.
I gave a lecture in New York City to a group of gastroenterologists, and I had asked my friend, I said, what should I talk about? He said, fiber. I was like, fiber? There's nothing sexy about fiber. And I got into this room with a group of gastroenterologists, and I said, fiber, and they were sitting back like this, rolling their eyes. But by the end of that lecture, the miracles that fiber caused, They were lining up to get my resources and the papers because when I give a lecture,
Amazing.
I know what I'm talking about. And it lowers cholesterol, it balances your hormones, it removes toxins, it feeds the gut microbiome. It's where, when your gut microbiome is healthy, it makes fine with the hair. People are taking biotin, but if you have the right gut microbiome, that hair vitamin biotin, you know,
Yes.
the gut microbiome makes that. People are on antidepressants. Well, you know what? Your gut microbiome makes
Make
serotonin,
serotonin, right?
and the serotonin helps you move your bowels. And you know what I see a lot? I ask
Constipation.
constipation, big time, right? And the
Yep.
women who don't do well on hormones are constipated. And they'll say, oh no, my bowel movements are normal. So I said, well, how often do you go? Oh, every 2 or 3 days. That's not normal, right? And then
Yeah.
what do they look like? Oh, it varies. They're mush or they're ball. No, you have to poop frogs and snakes, right? That's
Yes.
also not sexy, but it's
That's
so
right.
important.
I know. We laugh. I mean, I'm even as I feel myself laughing, I don't laugh as in funny for them because it's so hard when you are constipated, it really is horrible. And you feel bloated and you feel full and you feel all kinds of things and you're reabsorbing a lot of the toxins and a lot of the stuff that's packaged to go out, right?
Right.
But there is a solution. And I only laugh because it's so common and we don't realize that, yes, going every day and even twice a day would be really lovely, right? Not having interrupted days where you don't
It's
evacuate.
changed people's lives. They're like, oh, I didn't know how good I could feel, right? But I use the analogy, and it's kind of disgusting, but would you keep flushing a backed up toilet? That's what you're doing when you're constipated. All that stuff is going back into your system. And your liver is a recycling plant, whether you're on estrogen replacement or not. Even the menopausal women will make estrogen in their fat and adrenal glands. And unless you have the right bile flow and the fiber and you're detoxing and you're pooping logs or snakes, that those byproducts, and some of them are toxic. Your liver can detoxify estrogen in one of three ways. One is benign, one is semi-toxic, and another is very toxic. And those toxic ones damage DNA. And when they did studies on women whose liver made that type, they saw more either a family history of breast cancer or a history of breast cancer. And I've been measuring these byproducts for, oh my God, 15, 20 years. And it's always, the women who never had a history of breast cancer or a family history of breast cancer made the 2-hydroxyestrogen. But that's like clean
Mhm.
recycled garbage. It's still garbage. You still want to get rid of it. But the women who had a family history of breast cancer, or some women came to me after breast cancer because they wanted to feel better. I don't give hormones to women who have had breast cancer, but not because it causes breast cancer. Hormones do not cause breast cancer. I want to get that straight.
Mhm.
But there's not enough studies for me to feel comfortable to say, oh yeah, let's take it with wild, reckless abandon. But
Mhm.
they were the ones who had the family history of breast cancer or history of breast cancer because they made 4-hydroxyestrogen or 16. So just like you open a jar and it's all moldy and everything, right? You need
Right.
to get rid of that, and you need to methylate. Meaning methylate is like putting the lid back on and just disposing of it, right? You need to put your garbage in a can or a bag for the garbage man to take it. So I look at your urine to see how your liver is processing all your hormones, not just estrogen, and whether
Mhm.
or not you're able to dispose of it. Because women who have anxiety can have anxiety because of this enzyme, the COMT enzyme, which takes those estrogen byproducts, packages it so you can dispose of it, but it also takes epinephrine and norepinephrine. Adrenaline is like what makes you really
Mhm.
anxious. If that enzyme is not working right, you have two reasons to be anxious. You're reabsorbing the estrogen byproducts because they're sitting there, and
Mhm.
you're absorbing the adrenaline, which can cause anxiety. So all of
Right.
this fits together. And lots of cruciferous vegetables, broccoli, cauliflower, kale, Brussels sprouts, arugula, right? Fiber, magnesium,
Yeah.
magnesium. It's so relaxing, but it also provides energy to the cells. So, but I want to warn people, you start low and go slow with the fiber. Otherwise, you're not going to be happy. You're going to hate me because your
Right.
microbiome's not ready and you can get gas and bloating. So go in small increments, but it's a miracle how much better people feel.
Right. And hydration, right, Lorraine? Like with the increase in fiber, you have to match it with some hydration. Otherwise,
Yes.
sometimes it can work
And that's part
backwards.
of detox. That's part of detox. You
Yeah.
detox through, that's why I also love exercise because the heavy breathing, you breathe out CO2. That's,
Hmm.
acidic, right? You're hydrating, so your urine through your kidneys, you're detoxing. That allows your bowels to have what they call peristalsis, which pushes things out,
Hmm.
and that you get rid of toxins. The muscle contraction massages your lymph system, and it pushes things into the bloodstream so you can get rid of it through your poop or your pee, and you sweat and you get rid of a lot of toxins through sweat. So that's why it all fits together. And I say it's like baking a cake. You leave out one thing, it's a flop.
Right. Yeah. It's I love that. And I
So we
love
talked
it.
about eating and sleeping and
Yeah.
exercise and pooping.
And I love that you sort of simplify the notion of detoxification by saying, you stop the influx and you increase the output. And I think sometimes even the word detoxification for some people can be a little scary. It may mean that it's something that you do that's really radical or that you're using whatever, but it's like, no, it can be super simple. And it's very simple. You stop taking in what's harmful and you start letting go of what your body really doesn't want. And that, as you explained
And
so beautifully, is packaging to go out.
yeah, I'll use some detoxifying herbs. Like any women, before I put them on any hormones, I have them do a 2-week detoxification and elimination because some foods cause inflammation in some people. I mean, everybody's
Hmm.
like nervous about gluten free. Does everybody need to be gluten free? No, but I have to say that the gluten come from the States has been re-engineered to contain more gluten, and that stands for glue, and it's hard to break down, so it can inflame the system. But just for 2 weeks, we eliminate inflammatory foods, have a shake to heal the gut and decrease inflammation, which decreases inflammaging, right, for
Yeah.
longevity. And people feel good to great. Like 80% of people after that process feel good to great. And those who don't, then we have to look deeper. Is it mold? Is it heavy metals? Is it Lyme disease? Is it some chronic infection? Is it is something else going on? And it's usually something in the gut. If it's
Hmm.
if it's not overtly anything of those other things that I mentioned.
Yeah. So that's, I think you're getting to the answer to one of my questions, which was if people are kind of chasing symptoms, especially women in perimenopause again, where you're starting to feel a lot of fatigue and weight gain, mood swings, what is the thing they're overlooking, would you say, when they're going after those symptoms?
Definitely constipation because people think their bowel movements are normal, and normal is not necessarily optimal.
Hmm.
Studies that say most normal people in their 60s are on several medications, are overweight, have high blood pressure. Do you want to be normal? Do you want to be optimal, right? If you want to
Right.
live healthy, you want to be optimal. So the other thing is a lot of women suffer from gallbladder disorders. And, when you shift the fats in the diet from saturated fats to omega-3 fats, and you give bile salts, something like TUDCA, wow, they digest, they eliminate, because bile also is an antiseptic for the gut. It kills off the bad bacteria and also carries out toxins. And if you have a good gut microbiome, it just allows that process. If you have a bad gut microbiome, it's going to uncouple the toxins that are bound to the bile and they get reabsorbed. So we really need to pay attention to the gut because even Hippocrates said all disease begins in the gut. And
Yes.
when I use the analogy, if you had a party and you had beer and soda and French fries and burgers and pizza, you're going to attract a different crowd than if you had nice salads and, lean protein and roasted vegetables and fruit. It's night and day. What you feed your gut is what you're going to get, right?
Yeah. Yeah, absolutely. So the gut being the key here, and that's as you talked about hormones and this notion, especially during perimenopause and menopause, and trying to ease the symptoms that can come with that phase. It's not just looking at hormones, but looking at the gut, and that's the amazing combination. You also mentioned earlier, about the sort of toxins that we're all exposed to and how we may think we eat clean, but then when you look at testing, and I love that you also do testing, because I eat like maybe 90% organic, right? Of all the food when I'm shopping for my own household, for my family. And still I tested for glyphosate, right? It's like it's in so many things, and especially in wheat products, like you mentioned. And I, you know, there's many things you can avoid and still be exposed to some of these things. So I only mention this because it really is so important to detoxify. Coming back to like gut health, helping your gut microbiome so that they can help you detoxify. The bacteria can do so many different things as far as protection and detoxification and providing those nutrients. Um, what would you say are some of the sort of specific metabolism things that are related to this gut toxin and hormone triangle?
Well, the metabolism things. Well, we talked about the liver recycling,
Mhm.
right? So I also protect the liver. Sometimes I'll have to give herbs like milk thistle, otherwise known as silymarin, that helps the liver along. And I usually use blends because they're synergistic, meaning they work better together, a little bit less of all of that. So insulin resistance is a big one. And that's also can come from inflammation. And that's why I always attack the inflammation first, because that affects your hormones and it affects your metabolism. So if you're having a diet high in processed foods and simple carbohydrates or high in saturated fats, you're going to get insulin resistance, and it'll raise your blood pressure, raise your pulse, it'll raise your blood sugar, you'll gain weight, and it's going to interfere. Like polycystic ovarian syndrome is the root cause of that is insulin resistance. And we really need to be mindful of that one hormone is going to affect another hormone that's going to affect another hormone. And
Mhm.
all the hormones have to work together. And the big mother of all the hormones is cortisol, which is stress. So cortisol can disrupt all your other hormones as well as your immune system and your nervous system. So I want to expand the definition of stress because it's distress. Your body doesn't know the difference between running from a tiger or sitting on a tack. Pain, if it's physical, anything physical, pain, heat, cold, restless legs, emotional, worry, anxiety, depression, OCD, schizophrenia, any of those things, or chemical, which could be a hormone imbalance, nutritional excess, nutritional deficiency, poor microbiome. So all of those need to be looked at. And the thing is, I don't want to make it sound more complicated than it is. You
Mhm.
know, Eat whole foods, fresh fruits and vegetables that mostly organic. Drink clean water. Get a good night's sleep. Don't snack late. Don't get too much light at night because it's going to disrupt your hormones.
Mhm.
Uh, get some exercise, right? And what helps insulin resistance the most is resistance training. So I know people that love either just cardio or just resistance training. You need both.
Right.
And that detoxifies you. Yeah, right?
Exactly. And as much as walking is amazing and has many proven benefits, and I highly recommend it to everyone because walking and time in nature, fresh air, all of it. But it alone will not get us there. And so the resistance training, weight training doesn't have to be a ton of weight, but some form of muscle building, which I think is where you're
That
getting
along
at.
with yeah, that along with high intensity interval training, like push yourself a little bit. I love walking, right? It's to me, it's just so relaxing and it's beneficial. But sometimes you just have to push yourself a little and come back. Push yourself a little, lay back, and that exercises the arteries and the heart in a different way.
Beautiful. So I love that you brought in stress because that is such an important piece, I think. And my work, Lorraine, I talk a lot about self-love and as a practice because of the stress. You talked about a lot of these different stressors, and some we know. So like our maybe our housing situation, our relationship, our work situation, kids. There's like all the external stressors that we might be very aware of where we know oh, I'm stressed because of this. But then there's all the internal stressors we may not know of, which is toxin exposure, gut imbalances, the other things that you mentioned. And I think even food sensitivities, things that yeah we can test for when nothing else, when a sort of easy protocol doesn't work. As you said, people go through your cleanse 2 weeks, I do one too. And it's like if after that there's still something where they're not really feeling the benefits, then you have to investigate more. But ultimately, learning what your stressors are so you can, do something about them. Where do you see, as far as like most of the people that you work with, where those stressors are and how do you address them?
A lot of them, comes from how you think about things. I my husband told me I'm a stoic. It took me a long time to get there. Stoic stoics are not unfeeling, but
Mm,
stoics do not let their environment change their inner zen.
beautiful.
So regardless of what goes on about you, when I started working for this company, and it was just so different from working in a hospital, right?
Hmm.
The employee counselor gave me a framed version of the serenity prayer. Accept the thing, God give me and you don't have to use God, you can use universe, whatever. Give me serenity to accept the things I cannot change the things I can, and have the wisdom to know the difference. So one of my professors said to me, somebody on the plane just spilled red wine all over her white blouse. So she said, I am not going to get my cortisol up over this. You laugh it off. Okay, so you have the ability to respond differently. You could get all worked up, or you can say, it is what it is.
Hmm.
Take a deep breath, move on, because we're bombarded with so much information and so many demands in our time. Um, Set your priorities
Hmm.
and I love that you teach self-love because I find this more in women. They put themselves last.
Yeah.
And you need to put yourself and your health first so that you can do what you need to do. Burnout is so common, and I see that flatline cortisol because when
Hmm.
you're stressed, it goes up,
Yeah.
and it drops, and all hell breaks. That's where you get the chronic fatigue, the fibromyalgia, the autoimmune disorders,
Hmm.
poor response if you have cancer, frequent infections. You lost your zest for life. I can almost diagnose them across the room because they have the sunken eyes and they're like,
Yeah.
they can get out of bed. And it doesn't even have to be that bad. I have people with flatline cortisol that are still pushing themselves and they just lost their zest for life. So I'm happy that you teach self-love because self-love is is not just like bubble baths and a massage. No, it's
Hmm.
setting boundaries. It's setting your priorities. It's understanding your values. It's knowing what's most important for you this day, for you, for your family, for your work, for whatever it is that you want to try to accomplish.
Right.
So first, because that's what I'm seeing. I'm seeing scattered, too many demands and not really focusing on what's most important, what's going to move the needle the most. Just checking off that to-do list. And, sometimes you have to ask, what's going to happen if I don't do this today? Most of the time, it's nothing.
Yeah.
right? It's
Yep.
nothing. Nothing is going to happen, right?
And what you said about the body not recognizing the difference between the tiger and the tack, and it's the same thing with the self-love piece. I just want to mention this because people don't realize that if you're engaging with the opposite of self-love, which is the constant criticism and even up to self-loathing, which I know is a very loaded term, but so many women engage with those negative thoughts on a daily basis about themselves, about not being enough, about not doing it right, about never getting it right, whatever it is, that's the same stress that unleashes that cascade of like the hormone issue with the cortisol, and the blood sugar, and then the insulin, and then the lowering of the immune system. You
Yeah.
know, the issues with even the gut microbiome is affected by us engaging with those thoughts. And so that practicing self-love instead with, you know, and there are many practices. I'm curious about what some of your top practices are that you teach for your clients to help them prioritize themselves and to eat well, sleep well, and drink well,
Like
let's say, which is
I
hydration.
ask them to first of all recognize that they're human and that they don't have to be perfect. Because some people, it's like they come to me like it's a confessional. I said, like, I'm not judging you. I'm not judging you. I'm here guiding you. I'm like the GPS. Turn right, turn left. No judgment there. Why should you judge yourself? You're human, right? You're human. You get off the rails, you fall off the bike, you get back on. And think of it in that way. Don't, like you said, self-loathe, judge yourself, beat yourself up. I like well, deep belly breathing because you can do it anytime, anywhere. But we teach our
Mm.
patients heart math. I don't know if you're familiar with that.
Yeah, wonderful.
Yeah, I was practicing heart math and I brought it into my company when it was on cassette tapes. That's how old I am, right? Okay. Cassette tapes, because you don't need all these gadgets, but everybody wants the gadgets for the phone and stuff. But heart math is doing deep belly breathing, focusing on your heart and someone, someplace, something that you're deeply grateful for. It is so calming. They have over 200 studies, and the time it was introduced, when it was on cassette tapes, they used it for CEOs to increase their performance, their creativity, their innovation, and same thing with elite athletes. But they
Mm.
found that it helps everybody. It helps you sleep better. It decreases anxiety, decreases depression, increases innovation, creativity, decision making. So if you get yourself into a calm state, you're more likely to make a better decision.
Yes, I
You
love
make
that.
a decision that are like, I got,
Hmm.
oh, and he
Yeah.
just, and I'm gonna snap back. I need to tell him, you just take a step back, take a deep breath, let it sit. Don't respond immediately, you know? And that's
Yeah.
what Stoic philosophy is about. It's just, is this harming me? Is this something I need to react to right away? Most of the time, no.
Right. And just doing that, we've controlled our hormones based because we stopped that, you
Yes.
know, freeing up. And it's amazing too, because the whole notion of heart coherence, which is what we increase when we do something like what Lorraine is just explaining with the heart math, it also automatically increases our brain coherence, so we're able to think better. And so talk about an antidote, right, to the brain fog with the belly breathing and the
'Cause
gratitude.
yeah, I used to do big executive physicals and I had the program on the computer and, I tried it out on one of my staff and she says, I'm a meditator, go ahead. And I said, are you relaxed? Yeah. And then you see this curve that's going like a little jaggedy.
Mm.
So then I know she loved her dog. So I said, think about your dog. Immediately, beautiful, beautiful, smooth curve. I said, did you? And I saw it on her face because she's there with her eyes closed and like the face melted. And I said, did you feel different? She said, yes, I did. So it's very powerful when you combine them, but
Hmm.
always work your vagus nerve. So just like the hormones need to be balanced, estrogen, progesterone needs to be balanced, cortisol, DHEA needs to be balanced. Your sympathetic fight or flight nervous system needs to be balanced with the parasympathetic. The
Hmm.
rest, digest, reproduce, regenerate, repair, rejuvenate, right? So the way you do that is vagal exercises, and they're free. So I go in the shower and I belt it out. I sing. Singing is helpful. So I had one woman, I said, "What brought you joy?" She goes, "Singing." I said, "Oh, that's wonderful because you're exercising your vagal nerve." Just think if you
Yes.
only did biceps curls and you didn't exercise your tricep, you're stuck, right? And most of us are stuck in parasympathetic, going, 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 right?
Yeah.
So singing, when I'm cleaning, I hum. I will do, brush my teeth, I'll gargle, I'll gag. All of those activate the vagus nerve, and I give people a list of vagal exercises. Do what you like. Get a massage, massage your own feet, deep belly breathing. That's always my go-to.
Yeah.
Take a deep
Ah,
exhale longer than the inhale because, when you're shocked, you go, "Oh." But when you that works the parasympathetic. It's free,
beautiful. It's free. You can do it anywhere, right?
right? Exactly.
That's lovely. So,
Everything is not a supplement or a hormone, although I use a lot of supplements and I prescribe a lot of hormones, but really,
hmm.
these things make such a difference.
So, Lorraine, when somebody comes to see you, and let's say it's a woman in her 40s or 50s, they're feeling kind of stuck and exhausted and struggling, maybe with weight or energy and attention, where do you start? Where should we, where do you begin?
I start with a very detailed history, and then I may recommend some supplements based on that. And generally, most people are nutritionally deficient. I ask them how many servings of fruits and vegetables do you get a day, and it's a fist size.
Mhm.
Oh, I eat a lot. And they'll say 2 or 3. And I'm like, it's not gonna get you where you so I'll recommend a multivitamin mineral formula, sort of
Mhm.
like insurance policy, covering all the bases. A fish oil because most people have more saturated fat and processed foods that have more omega-6, so the omega-3 balances that out, and vitamin
Mhm.
K2, D3, and depending upon what their symptoms are, I may recommend a few other things. I'll do pretty detailed tests for inflammation, hormones, glycation, all those processes of aging.
Mhm.
Glycation is sugar binding to protein. And I say, if you see a cataract, that's what sugar binding to protein is. A cataract is something you can see, but it can happen all over your body. So I'm going to measure hemoglobin A1C. I'm going to measure blood sugar. I'm going to measure insulin. I'm going to measure C reactive protein, something that is a marker for inflammation. I
Yeah.
measure your hormones, and I'm going to do cortisol. A lot of people leave that out, but that's like your mother hormone that's
Mhm.
going to disrupt the others. And then I turn them over to my nutrition and lifestyle coach who will do that, prepare them for this 2-week detox, and then they eat food, but they eliminate the inflammatory foods for 2 weeks. And then they introduce them back in their poor form one at a time. And by
Mhm.
that, and then they'll see, like, I felt good before, but usually by the second week, people feel good. First week, not everybody likes me, right?
Yeah. Yeah. I'm there. Yeah.
Yeah. So by the
Especially when you
second,
remove, it's usually for
yeah,
me, and I don't know if it's the same for you, but it's sugar, dairy, gluten, caffeine. We take out coffee. I also take almost soy unless I'm working with somebody who's vegetarian, and we'll keep tempeh. Um, but I'm looking to reduce like soy products like soy milk and some, and tofu and other soy things. And I also eliminate corn and peanuts for the most part for that first.
the same things,
Is that
yes.
the same?
And
Okay.
of course, alcohol.
And alcohol, yes.
I do. I mean, I'm a little stricter. I'll eliminate eggs because sometimes for some people it's eggs. Uh,
Hmm.
and alcohol and any artificial sweeteners, colorings. I want them to eat
Yes,
pure,
same.
whole, clean food. And then they do a symptom questionnaire before and after, and like, oh my God, some people's scores drop. The more symptoms and more severe the symptoms you have, that's a higher score, and others, the score drops significantly. And they say, yeah, I'm sleeping better, I have more energy, brain fog lifted, I'm not as moody. And then I'll review their blood tests and their saliva tests with them. And then we come up with a plan, you know.
Beautiful.
Some people
So
feel good after that, but other people, like, they're a little further out and need more help, need more help.
mhm,
I'll
mhm.
prescribe hormones or whatever else a person needs.
Beautiful. So how can people learn more about what you do and get engaged with your work, Lorraine?
Well, I have two websites. I'm sorry because the regulations say a doctor can't teach. So my medical practice is vibranceforlife.com, and my coaching and courses practice is the Feel Good Again Institute. So if you want education, and a lot of people want to understand themselves, the Feel Good Again, it has to have the an institute after it, otherwise you get a drug rehab center.
Okay. Oh, good to
The
know.
feelgoodaganinstitute.com or vibranceforlife.com, and they communicate with each other. So wherever you land, and or you could just type in my name, Lorraine Maita,
Beautiful.
MD, but I can't say I'm an MD on the other one, on the Feel Good Again Institute. One of my friends got like, "What happened? You're still a doctor?" Right? I said, "Yeah, regulations say if when you're coaching, you can't say you're a doctor, because not everybody is in a state that I'm licensed in, and not everybody uh,
I see.
will want to, have a one-on-one with me, right? So
Yeah. Oh my gosh, that's very interesting. But so good to know. We have both. We'll put both of them in the show notes. And before we sign off, I'm just wondering if there's anything else you wanted to mention about either what you do or maybe like a one or two hacks that you feel like every woman should be looking at.
the main thing is your attitude, how you embrace life, how you proceed. Never give up. I mean, I've had people right on the verge of just ready to give up. Never give up, because your body has an amazing ability to heal. You remove, I call it the vitality formula. Add what's missing, remove what's hindering, multiply what's working well, and you get out of your own way and you just heal. And
Mm,
just and live your life with joy. Joy,
beautiful.
joy. It's healing.
And
Joy
you
and gratitude. It's so important. Changes your hormones, your nervous system, your physiology, and your outlook on life.
and knowing that you've gone through so much and you still are here sharing this message, and that you really, I feel it having met you in person, that you really pass that on with the joy. So
Absolutely.
you really walk your talk. Thank you so much for being here today.
Thank you for having me. We got to get the message out. Live your life with joy and health.